Today we're actually talking about a very interesting topic, the role of parenting programs to address forms of violence that occur in the family. This includes both violence against children and violence against women. We know over the years, parenting programs have been designed to improve parenting practices and improve child well-being outcomes. But we know for this to happen, we need safe, stable, and supportive households where children grow up with supportive caregivers, where children are safe within families. And for us to be able to ensure this, it is important for us to address both violence against children and violence against women within the households. And we know that these parenting programs have the great potential to be able to address these both forms of violence. Violence within the family, especially against children, undermines the well-being of children. And we also know that when mothers or when women experience violence within the family, it undermines their ability to provide responsive care for children. So the role of parenting programs in addressing these both forms of violence remains quite key in the context where we work, because if we want our children to develop well, if we want families to be able to thrive, there's no way we can blind ourselves on the consequences of violence within the family. Great opportunity is there, and that is why then we have the opportunity to constantly enrich and adapt our parenting programs to work at the intersections of both violence against children and violence against women.
In a program such as this is a Skilful Parenting Program, or in a positive parenting program that targets the community, there are different partners that are involved. This includes the community members who are also stakeholders, but also the facilitators that we work with. We also have government, but also we have civil society organizations who would also play the role of implementing, as well as capacity building. So for this particular program, which is an accompaniment program, the role of partnership, and what I would say would make a strong partnership, includes collaborative engagement, so the ability to work together, understanding one another in terms of expectation, but also knowing the expectation of one partner in the other. So aligning that would be very important. A mutual understanding or a mutual relationship based on how you're able to communicate. So timely communication would be important. Clarifying expectations, ensuring that you're able to speak with one another in good time around schedules. That is something that we experienced during our engagement with Prevention Collaborative. There were other competing priorities, and at times you were forced to reschedule. So that also helped to ensure that we are able to communicate and to reschedule effectively. The other thing was feedback, and I would speak about very honest feedback from both partners. So like I mentioned, that this engagement involved different partners. We had the community teams, our facilitators. We also had ourselves as staff, but also we had the government officials. Working with everyone was very effective in ensuring that we're able to gather feedback on what is working. I think the other thing that I would say made a strong partnership is teamwork, because this work involved different people. We had our staff members working, but even amongst the staff, then we have teams with different expertise. Some are good at sharing the implementation experience, looking at in a program, one of the partners, even when they're being supported to develop the programs, they also have some knowledge, they have some expertise. So I think what worked really well for us was the aspect that Prevention Collaborative actually acknowledge that ICS are the experts. They have, the strength and the expertise to do this work, and just building on that strength instead of coming up with totally new. So there were the experts in gender transformative aspect, but few were the experts in parenting. So bringing that together was also important. So the actual work involved co-creation, and co-designing, that whereas there were certain modules where integration was possible, later on we had to make a decision to also create a totally new module. So for example, in the second module on roles and responsibilities, we had to bring in a concept of, bringing in the roles of the men, the roles of the women, because initially what was just having the modules on roles and responsibilities, although specifying what are the roles of men and women, and just seeing how gender norms and societal norms play a role in distinguishing what men do different from what the women do. So once we finalized the development and integration, then there was the aspect around piloting this with staff. And actually that was very interesting, because even as we continued to look at the content, we realized that as staff who are also part of the delivery team, it was important that we understood what that meant in practice. When you're talking about also part of the co-design, we also had a lot of community engagement, because we were not just delivering that as staff, but we were delivering that together with the frontline workers. So in the co-creation, we also had to bring in the community facilitators, who are our delivery agents as the frontline workers, to just share with us what have been their experiences, what have been the topics on gender that have been coming up, and what is their suggestion. ICS played several roles in the adaptation of the Gender Transformative Skilful Parenting Program to the National Positive Parenting Program. I think the first role that I would say was just basically to share our model. Now, at this point, the government was looking for solutions to address violence against children based on the Violence Against Children survey that was conducted in 2019. The other role was also to participate now in the task force, sharing our experience in that technical expertise around parenting. So ICS was appointed in the National Parenting Technical Working Group as one of the partners who have, homegrown solutions. And so our responsibility was to bring together the wealth of experience and the knowledge we have around implementing parenting programs, but also offering solutions that reduce violence against children. Thereafter, we also had a role in supporting the adaptation of the parenting program. So after all the partners had brought in the solutions and the models they're implementing, then the government was able to settle on adapting the Skilful Parenting Program. And so our role was to support that adaptation. I remember when you're talking about adaptation is that not all the content in the current Skilful Parenting Program went into the National Positive Parenting Program. So we supported to share the processes and the steps of, what would go into the parenting program.
Putting the program was an opportunity for us to showcase how the program would look like in practice, and through that address the gaps that might be there, and also improve the design through the lessons that will be learned. With scale in mind, the pilot was designed to be led by government. It was also implemented in the context of government in terms of the resources that were available, and also the workforce that were engaged. Kilifi and Garissa counties readily embraced the program when they realized its potential to address the social and economical issues that affect their community. They identified their roles and executed their mandate in the pilot very, very well. The religious and cultural leaders also accepted the program. For example, the standard operating procedure for referral and the social behavior change communication strategy for parenting. We had organizations that also took a great interest in the program. These organizations provided platform for the beneficiaries to be trained, and some organizations, including churches, even supported the program post the pilot period. The interest was also very high in the community, as evidenced by over 86% of parents and caregivers that were engaged who completed the 15 weeks. The pilot provided lessons that will be incorporated in the scaling of the program nationally. First, the benefits of integrating the National Positive Parenting Program with other programs. For example, health and nutrition and economic strengthening program, where it was seen that they complemented each other very well and also improve the outcomes of the individual programs. Secondly, the pilot provided a blueprint for costing of the intervention, that has been very instrumental to government and other stakeholders who are implementing the same program.
There are a number of lessons that I can highlight with regards to implementing the gender transformative parenting program. Number one, for the successful implementation of the gender transformative parenting program, we have to be cognizant of the predominant gender norms and the gender inequalities. This because the gender norms and inequalities, to a great extent, they influence the family dynamics, how the family members interact, and even how they make their decisions. And then lesson number two, getting men and male caregivers to attend structured parenting sessions is not a simple task. And therefore, there's a need of coming up with strategies and techniques on how to have more men participate in the parenting session. This because we understand that men are involved to a great extent, searching for their family members as the breadwinners, so they're involved in the job opportunities and even employment opportunities, making it not easy for them to attend structured parenting sessions. And therefore, ICS has been coming up with techniques on how to have this information reaching out to more number of men. For instance, we have been giving out takeaway assignments whereby the female caregivers and even women are able to go back home and share with their male counterparts. And so through this, more men have been getting information, and even some have been coming to attend this one because of the information being passed to them by their female counterparts. We have been using our ICS male champions to form and strengthen the fatherhood parleys. The fatherhood parleys, these are the group meetings whereby men sit together and discuss how to become responsible fathers in the society. We have also been using our frontline workers to target men in their settings, for example, the transport sectors, and even during the church services.
The key tips for scaling a program such as this one begins at the design process. So what do you want to scale? How do you want to scale it, and through which pathway you want to scale it through? So that has to be very clear as an organization. You have to build your internal capacity as an organization to scale. Scaling requires that you have not only implementation capacity, but advocacy capacity, networking, relationship building, partnership capacity, but also awareness of context and the policy opportunities through which you want to scale your program. And this was especially important for us because one pathway that we identified for scale for this program was through government. And one of those key opportunities was, of course, the Kenya Prevention Response Plan for Violence Against Children that had noted parent and caregiver capacity to be one of those strategic priorities that is open for us to address violence against children. The second tip that I would give, you need to have a flexible, scalable framework, because there are available scaling frameworks out there that can provide a basic foundation for guidance, but context is very different. You cannot do the scaling journey alone. You have to have many partners who believe in your mission and cause and can work together with you to take this forward. So you need to do a very thorough stakeholder analysis for you to be able to identify your allies, your supporters, and also financial support. Build relationships with them, have a good vision going towards scale together with them, and collaborate with government and various ministries in government for that matter, because parenting is a discipline that cuts across many ministries or departments in government. This includes the children's services, this includes social development, this includes health, this includes education. So your context awareness needs to be a lot more sound. The other tip around scaling parenting programs is it takes time. So patience is very, very important, because when you're scaling, you can have a time frame in mind, but sometimes things don't happen within the time frame that you envisage. And some of the results you see towards the end, it could be year 5 or 6. Our scaling journey has taken us close to 6 years to make it happen. The Skilful Parenting Program now was officially adopted by government. A lot of misconception and misunderstanding about what gender transformative parenting programs mean and what the outcome is. So you need to constantly raise this awareness, create this awareness of what these programs are, their potential, and why they are quite unique in terms of addressing the deep-rooted social norms that actually allow violence to continue within the family settings in the contexts where we work. The partnership with Prevention Collaborative has not only been able to support us in enriching the parenting program, we have used that knowledge to enrich other solutions within our organization to make them gender transformative. We know one of the greatest challenges in our sector in the work that we do is to address, to challenge and transform the deep-seated harmful gender norms, social norms that are available. Other solutions that we are developing to address violence in and around schools, to be able to promote the education and the well-being of children across many developmental domains are now more gender transformative. We are looking at sustainable futures. The whole idea is to ensure that our children grow up in stable, nurturing, and supportive environments. So if we are able to reach more than half of the parents and caregivers in Kenya and in Tanzania, there's a lot of transformation that we can already see within our communities, within our nation, and this will translate to what we want to challenge even through the Sustainable Development Goals that we have to achieve by 2030. So we have 5 years to go, but this is one of those solutions that we really see cuts across several Sustainable Development Goals and can get us there quite quicker and faster with less resources.